What qualities do you need to be a nurse? This is an interesting question posted by the tribe. I think it was actually posted on YouTube as a comment. Someone's asking, I think they're interested in becoming a nurse and want to know what qualities they may need or not need. You can do a quick Google search on this one. It's quite popular out there, and you could get lost in the madness of how many qualities and how many experts out there talk about all the qualities required and needed to be a nurse, to be a good nurse, to be a strong nurse. I'm going to stick to my own personal five qualities needed to be a nurse. These are what I would expect you to have in order to make it in the profession. If you're interested in becoming a nurse, these are the 5 things, the qualities that I think every nurse needs to have in order to effectively participate in your patient's care, to improve outcomes, and to place an active role in the profession. Number 1, self-awareness. This is a very vague term, but it comes down to being in touch with your feelings, your emotions, knowing thyself. And I'm literally looking at the screen what the definition of self-awareness is. The conscious knowledge of one's own character, feeling, motives, and desires. When you're in nursing school, if and when you go there, we talk about self-biasness, that each of us, due to where we grew up and the environment in which we grew up in, you're going to have biasness. You're going to have self-biases whether you like it or not. To deny them is flat out lying. I'm not saying you're going to be bigoted. This has to do with biasness towards decisions and biasness towards evaluation. So you need to have the self-awareness to know what your biases are, man, so that you can effectively do your job without compromising patient care. And I take it a step further with self-awareness. You also have to have the self-awareness to know when you are wrong. You have to be willing to be wrong, willing and able to recognize that you are wrong about anything, whether it be patient care, interpersonal relationships, having the ability to take a step back and realize that you were at fault and not the other person. That passive-aggressive behavior is what's tearing our profession apart right now. And having the self-awareness to realize that you have elicited some of that behavior is the first step to eliminating the behavior. Number 2, empathy. This goes without saying. If you do not have empathy for your fellow human being, you're in the wrong profession. You need to just not even consider it. If you can't empathize with any patient on anything about whatever is going on in their world, it is our job. The underlying theme of being a nurse is to be a patient advocate. That you are going to speak for that patient when they can't speak for themselves. And if you can't speak with an empathetic voice, then you shouldn't be a nurse. You have to have empathy for your fellow human being. You don't have to have pity. You have to have empathy. Number 3, Communicator. You have to be a communicator. The majority of your job as a nurse is going to be communicating with someone or some entity at all times. Whether communicating with the patient, the family, the friends, communicating with the provider, the PA, the NP, the doctor, ancillary staff. You're going to be talking to other providers, dentists, surgeons, occupational therapists, physical therapists, speech therapists, respiratory therapists. You're going to communicate with your colleagues, fellow nurses, advanced practice nurses. You're going to have to communicate with students of all flavors, whether medicine students, residents, nursing students, NP students. You're going to have to communicate with the public at large. You're going to have to communicate with people over the phone, communicate with people through a computer. You are going to have to be not only good at listening, but you have to be effective in relaying information at all levels. You have to be able to communicate not only in the language that is inherent to a nurse, but you have to communicate in layman's terms. You have to break down the complex into the simple for those patients and families and friends and other team members of the medical team. Healthcare involves a lot of people, and nurses are the linchpin of healthcare. You connect the dots. So you have to effectively communicate with different genres, different people in different categories at all times. If you cannot do that, you will be unable to do your job. Period. Number 4, critical thinking. Now, you don't have to be an adrenaline junkie kind of critical thinker. You don't have to work in the ER. You don't have to work in the ICU or in any other specialty area. You don't have to work in the operating room. You don't have to operate at a high acuity level, but you have to be able to exhibit some level of critical thinking. You know, when that flag goes off in the back of your brain that says, "Ooh, that's wrong," or "Ooh, something's off." You know, being able to listen to your gut, but navigating and negotiating using your brain and your heart. You have to have some level of critical thinking skills. It's what we get paid for. This is a hard pill to swallow, but regardless of what patient population you are caring for, doesn't matter what setting, inpatient, outpatient, can be in a nursing home or it can be in the ICU with the sickest of the sick. Your decisions are life and death. Your mistakes can kill someone. I'm not saying you're doing it on purpose, but the checks and balances that are there, your decisions that you make affect human lives. So you need to have some level of critical thinking skills. You may not know you have them or not. This is a skill that you can develop, but you have to have some baseline knowledge. You just do. Number 5, last but not least, emotional intelligence. You have to be in control and in touch with your own personal emotions. In the business of healthcare, in the world of nursing, emotions will roller coaster throughout your career, let alone a singular shift. Your emotions are going to run wild. Sometimes they will get the best of you, sometimes they will beat you down, and sometimes they will elevate you. You have to have the emotional intelligence to have control over all of that. You're going to meet, greet, and have to interact with some of the best of the human population and some of the worst. You will always have to deal with a human being when they are dealing with one of the worst days of their lives. And people handle that differently. They have different coping mechanisms. They're scared. Most of your patients are scared in some level. At some level, they are afraid of what could happen, what is happening, or what has happened. So emotions will run wild. And you will be part of that emotional roller coaster for many people, including yourself. You have to have the ability to maintain composure, maintain your professionalism, and keep control of your emotions at some of the most important moments of other people's lives. I'm not saying you have to be emotionless. You just have to be able to center yourself, calm yourself, and know when you are in above your head. Those who you get to be two people. You get one of two choices. You either control your emotions, or your emotions are going to control you. And as a nurse, you cannot let your emotions control you. Every nurse has to be in control of their own emotions.